Welcome to Beyond 2020, a project of the Nebraska Optometric Association. This episode, we are pleased to welcome Dr. Brandon Webb from Lincoln here, family practitioner, so you see a little bit of everything, correct? Why don't you give us a little background about yourself, where you went to school, how long you've been back here? Oh, that's excellent, excellent. So my wife's from Nashville, Tennessee, so I've got a little connection back to the Tennessee world for you.
All of my family's in Nashville now.
Oh,
so
excellent.
My parents, my brother, all in Nashville now.
Excellent. Well, the whole purpose of Beyond 2020 is kind of reaching out to patients, clinics, different systems within the state that try to get information out to people. Interweaving eye care into general health, of course, because as you know, with letters you get back and forth between different providers. We want to get it at the patient's top of mind when it comes to thinking about the eyes beyond just looking at a chart and reading 2020. So thank you for being here today. We wanted to get a family practitioner on to kind of talk about that importance as the family practitioner with getting information about the patient's entire health system. Obviously, there's only so much you can do during an exam, and so when you have I guess patients, they will ask me, like, why do you want to know what doctor I go to, or why are you asking me about my blood pressure, why are you asking me about my diabetes, And my first goal is always, if there is any of those health conditions, to get that information about their eyes to you. But from the family practitioner side of things, why is that important? What information do you get from the eyes or from that letter follow-up from the patient's eye care provider? For sure. Yeah, I run into that question from a patient. So sometimes get a referral back over where the screening caught one eye not seeing well, and then so the initial thought is, all right, let's check the prescription. All right, prescription's actually okay. Or in some cases, the prescription doesn't improve that vision, and so all right, now we got to dig deeper. What's happening? In the very rare instances, possibly leads to a discovery of a tumor, possibly leads to glaucoma, because I think a misconception from a patient standpoint is if it's bad, it's going to hurt, and in the eyes, there's not really that proprioception that's coming back and hurting when something is happening, and so I try to impress upon my patients that a change in vision isn't always just I'm going to change your glasses or change your contacts. It could be something else we need to dig into deeper. So. Kind of along the same lines, you were talking about cardiovascular health. I had a patient, this was 2 years ago, and he came in for the first time. He's probably in mid-50s. And we were going through the health history, and at first he was kind of asking, why are you asking these questions, And so then I asked him about his family history. Is there any blood pressure, diabetes, or whatnot? And he's like, well, no. And then he kind of started laughing to himself. And he's like, well, my family doesn't really go get themselves checked out, right? Hear that? So get through the exam. He's seen 20/20. Everything looks good. So get him dilating. And I look in the back of his eyes, and he has little bleeds all throughout his retina. And so checked his blood pressure right there, and he was 190 over 120. So he didn't have a doctor, as he mentioned, so we called the physician right up the street, and we're like, we're sending someone to you right away, And sure enough, he had high blood pressure and got treated and came back in, and he was like, hey, I had no idea. I just thought I was feeling 55 years old, or whatnot. So it's those types of things that, and kind of coordinating that care, kind of like you were mentioning on that family practitioner side, knowing a lot, about everything, but not being able to necessarily be that specialist. Kind of in the same way for us as optometrists is knowing a lot about the eyes, some of the things systemically, but then if we need to getting back to the family practitioner, getting to the ophthalmologist for surgery or whatnot, and being able to figure out where that referral needs to go. So on the patient side of things for you in terms of getting that information, let's talk about diabetes. So like you said, there's a lot of intricate details that you can see in the back of the eye. Probably the only place in the body that you can observe blood vessels and capillaries really, especially without cutting or doing anything like that. So if you get that letter back, does it change your approach? Let's say you're treating a diabetic and you think things are pretty well controlled, but you get a letter back about some hemes or some retinopathy that's going on. Does that change how hard you're pushing to control that A1C number?
It does. And
Yeah, I think another piece of that is having that consistent paper that looks the same every time it comes over, so you know where the information is at, what it's coming from, where they check the boxes and whatnot. That's a huge piece of it. You know, on the back side of that, a lot of patients will show up. You know, my doctor said I needed an eye exam. You know, and so we get into why that is or whatnot. But one of the challenges on the primary eye care side of that, I think too, is a patient understanding for themselves of what coverages they have, because eye care is a little unusual. You sort of have two buckets of insurance. You've got your routine eye care, and you have access to your medical insurance too. And so I do think there's, like using diabetics as an example, macular degeneration, glaucoma, any of those, eye infection, dry eyes, those kind of things, where we get a lot of patients who will put that off because I don't have eye insurance. That's great, because if you have health insurance, that is something we can submit to, you know, and getting that message out to more patients that, you know, if you're diabetic and you don't have that routine vision insurance, that's okay. We can still actually see you for your exam. And I think as people get more comfortable with that idea, hopefully that also means they'll follow up and get their exams done on time and as needed. So, are those HEDIS scores? Are you talking about the HEDIS scores, or are you talking about the PQRS scores? Yeah. Right, right.
Because I lead that part of our practice too.
Sure. Well, and I think that's from a patient, the patient side of things, where it's important to really have your healthcare team, where not only are you feeling taken care of within your healthcare team, but you also trust what's happening with that information, because obviously the big concern is privacy and making sure that's protected, but you got to trust that your healthcare team is protecting that information, sharing it with the people that it needs to be shared with, and getting it back.
Yeah,
Right. Well, that kind of takes me back. You kind of got into some A1C numbers there, and one of the things that on the eye side of things. So you mentioned that insurance sometimes says if we can get it below an 8, we're in good shape, right? From an eye side of things, we talk to the patients about risk of retinopathy, and if you're at a 7, you're at about a 15% risk of retinopathy. If you get down to 6.5, you're at 5%, and that is one of the confounding things, though, with the insurance and in working with other good practitioners and realizing somehow patients get it in their mind too that what the insurance company says is good enough, right? And so unfortunately I've had a couple of patients they've ridden the A1C at about an 8, and it felt good every time you ask them, like, "Are you working on getting it down?" "No, it's good. It's right where it's supposed to be," And you talk about quality of life, and so I had a patient fairly recently who'd kind of ridden an A1C number right there at 8. Did need glasses, saw 20/20, big outdoors person, and then showed up one day, could not see better than 20/50, macula in both of his eyes were bleeding, and so he's had a permanent vision loss at that point. So keeping that communication circle going is just huge, and I love what the ACOs are doing to try to help bring that along. With all of the different disease, do you think too we're going to see more, and I know we see it in some insurance companies, but where patients will, or their insurance company will help with like exercise and kind of those preventative measures to even get there before you have the issue?
Well, okay, you won't pay for that, but you want us to do better with CPD.
Right.
So, but again, I think it's the
Isn't it kind of interesting too? You talked about insurance companies looking at the lifetime, right? In almost every one of the diseases that you listed off is in some way affected by lifestyle choices. Also, from a patient side of things, the smoking, certainly the nutrition. I mean, I can vouch for myself and my nutritional habits, which aren't the greatest. If there was a way down the road where we can get to people at that younger age and again trying to impress as best we can about the lifelong of their health, their vision, and those kind of things, and these choices are free to make in terms of just what you're doing to yourself, that would also help with our long-term outlook. So. For sure, for sure. Well, hey, this has been great. We really appreciate you joining us tonight. So we may be getting into diabetes again at a later date, a little bit deeper. So we may see if you can return to the show here at some point. So thank you very much.
absolutely great.
We also would like to give a thanks to the Nebraska Optometric Association and the Executive Director, Dave McBride, Beyond 2020 producer, Christian Anderson with Right Eye Digital, Parsons Public Relations, We do want to encourage everybody to look for the latest episode of Beyond 2020 at bettereyecarenebraska.com, on the NOA YouTube channel, and all your favorite podcast platforms, and also follow us on Facebook. If you have questions, please contact us at Nebraska Optometric Association. Until next time, thanks for watching and listening.